This conference will now be recorded.
Hello, everyone, and welcome to our very first virtual celebration in honor of National Breastfeeding Month. August 6, 2011, the United States Breastfeeding Committee officially declared August National Breastfeeding Month. The mission is to improve the nation's health by working together to promote, protect, and support breastfeeding. The vision is to see breastfeeding as the norm for infants and young children in the United States, and that all families have the opportunity to breastfeed. For those participants that like and share this video, we will raffle this Altura diaper bag that includes diapers and lots of other goodies. We included a cushion for your infant car seat, a sippy cup, an Altura baby beanie, some wipes. We also included a dozen diapers, a baby thermometer. This is a little cooler bag for storing your breast milk, and also some breast milk storage containers from Snappies. We also are including with the raffle this breastfeeding starter kit. So my name is Michelle De Leon. I am the lactation consultant at Altura Centers for Health here in Tulare. I work at the pediatric clinic helping families with any breastfeeding concerns by providing education to our expecting families. This month of August, we are celebrating National Breastfeeding Month. We recognize the importance of breastfeeding, and we provide free lactation services to all of our patients. Breastfeeding education is so important, and it's offered during pregnancy because we want all of our families to make an informed decision on how to feed their baby. So I wanted to go over with you a few of the benefits to breastfeeding. Some of those including there is increased bonding between mom and baby, increased immunities. Those antibodies that you pass through your breast milk to your baby are so beneficial. It's perfectly matched nutrition. It's human milk for a human baby. Breast milk is easily digested. It can also help reduce the risk of allergies, infections, and certain chronic illnesses. It stimulates your baby's sense of taste and smell. For mothers, it helps reduce the risk of certain types of cancers, heart disease, and it helps her body recover faster. For the family overall, it saves money. So some of you do have some concerns about breastfeeding during this pandemic of COVID-19, and it can be a really stressful time, but with the information we have available, it is still strongly recommended for mothers to continue breastfeeding during this pandemic. So if you do have symptoms of infection, these are some recommendations. If you have symptoms of infection, we want you to be washing your hands frequently before and after touching your baby. Wear a face covering while breastfeeding. Limit face-to-face time with your infant to reduce exposure. Although skin-to-skin is still recommended, and that can be done still using a face mask. Avoid touching your face. You may also choose to have someone else feed your baby express breast milk if you're unable to breastfeed directly. So if you have no symptoms of infection, we really would recommend for you to continue practicing social distancing, avoid touching your face, wash your hands frequently, and continue breastfeeding. This is the recommendation from the World Health Organization. They say to continue supporting women with COVID-19 to breastfeed safely, hold her newborn skin to skin, and share a room with her baby. So close contact and early exclusive breastfeeding helps a baby to thrive. So we can see from the picture here, there's an example of a mother that's breastfeeding and she's using a face covering. Pumping during the pandemic, these are some recommendations, which would be to wash your hands frequently before and after pumping, disinfect and wipe down all surfaces. If possible, clean your breast before pumping, disinfect your pump parts after each use. If you have symptoms of infection, make sure you're wearing a face covering while pumping. And as we learn more about this virus, guidelines can change. So if you would like more information, please feel free to schedule a visit with me in person, by video, or by phone, and I'd be happy to meet with you. So now I would like to introduce some of our pediatricians here at Altura Centers for Health who will discuss how they support breastfeeding families at our clinic. So first we have Dr. Elise.
I'm Dr. Elise and from Altura Pediatrics, and I have been asked to make a little video about why I support breastfeeding. Yes, I do support breastfeeding for a number of reasons that I can't even begin to fit in this video, but they're just real short and quick. You know, there is the obvious medical health benefits to the baby in terms of, you know, a breastfed child tends to have less issues with things like ear infections, allergies, obesity. Breastfeeding in newborns, you know, it's easier to digest, it's easier on the gut, on the stomach, so there's less, you know, constipation and fussiness, and cramping, and gas. Breastfeeding has been shown to protect against sudden infant death, and so there are so many reasons why I do support breastfeeding. Outside of the obvious medical advantages, we also have the psychological aspect of it. You know, that bonding between a mom and her baby. She puts her baby to her breast for the very first time, and when they look into each other's eyes, I mean, there's just something magical that happens. So there's that bonding, and even, you know, some studies are even saying that breastfed babies tend to be more intelligent. Well, like I said, you know, for the whole well-being of the mom, the child, emotional, physical, psychological, you can't beat breastfeeding. You know, it's something I highly encourage, and I am so glad that Altura promotes that. And we have an awesome lactation specialist here, Michelle, who helps us tremendously working with our patients. And so, yeah, go Michelle, go Altura, go all the breastfeeding moms, and keep doing it.
Next we have Dr. Palamaki.
Hi, my name is Dr. Palamaki, and I'm one of the physicians at Altura Centers for Health. I've been at the clinic for over 8 years now. August is National Breastfeeding Month, and at Altura Centers for Health, we celebrate breastfeeding every day. Breast milk is the healthiest milk for your child, and American Academy of Pediatrics recommends breast milk for the first 6 months of life. Breast milk is important to help your baby's digestion, their immune system, and to prevent chronic illnesses such as asthma, allergies, and obesity. Breastfeeding at the beginning is not always easy, but at Altura Centers for Health, we have many avenues for support, such as lactation consultants, and all of our pediatricians are well versed in the best breastfeeding practices. So choose breast milk, and your baby will thank you.
Hi, my name is Dion. I'm a vegan. And I'm a healthy, strong boy.
And next we have Dr. Becker.
Hi, I'm Dr. Sarah Baker from Altura Center for Health. In celebration of National Breastfeeding Month, we have decided to make a video to motivate our parents to breastfeed. What are the benefits of breastfeeding? There's so many. One of them is that through the breast milk, you can pass antibodies to the baby to decrease the risk of infections. Also, some of the benefits that breast milk provides is that it decreases the risk of diarrhea, it decreases the risk of respiratory, urinary infections, ear infections, diabetes, obesity, and asthma in the future. And one of my favorites is that through breast milk, we can decrease the risk of cancer, even leukemia. For that reason, I encourage our families to breastfeed. I understand as a mother that sometimes the journey can be difficult, but don't forget to look at the resources that your community has. For example, Altura Center for Health has a lactation coordinator, Michelle De Leon, which personally helped me a lot during the process. So if you have any questions or any doubt on how to breastfeed your baby, please contact us for an appointment.
So now we would like to hear from all of you. What questions do you have? And feel free to comment with your questions. After this presentation, we will be contacting the raffle winner via message to arrange a pickup day and time. So in conclusion, I want to thank all of our breastfeeding families. You really are giving the best to your baby and the healthiest start in life. Happy National Breastfeeding Month.